1. A 21-year-old patient has a lesion of the upper trunk of the brachial plexus, abduction. Paralysis. Which of the following is the most likely diagnosis? A. Paralysis of the rhomboid major. B. Inability to elevate the arm above their horizontal. C. Arm tending to lie in medial rotation. D. Loss of sensation on the medial side of the arm. E. Inability to adduct the thumb. 1. The answer is C. A lesion of the upper trunk of the brachial plexus results in a condition called waiter's tip hand, in which the arm tends to lie in medial rotation because of paralysis of lateral rotators and abductors of the arm. The long thoracic nerve, which rises from the root C5-C7 of the brachial plexus, innervates the serratus anterior muscle that can elevate the arm above the horizontal. The dorsal scapular nerve, which rises from the root C5, innervates their rhomboid major. The medial side of the arm receives cutaneous innervation from the medial brachial cutaneous nerve of the medial cord. The adductor pollicis is innervated by the ulnar nerve. 2. A patient comes in with a gunshot wound and requires surgery in which his thoracoacromial trunk needs to be ligated. Which of the following arterial branches would maintain normal blood flow? A. Acromial. B. Pectoral. C. Clavicular. D. Deltoid. E. Superior thoracic. 2. The answer is E. The superior thoracic artery is a direct branch of the axillary artery. The thoracoacromial trunk has 4 branches: the pectoral, clavicular, acromial, and deltoid. 3. A 29-year-old man comes in with a stab wound, cannot raise his arm above horizontal, and exhibits a condition known as winged scapula. Which of the following structures of their brachial plexus would most likely be damaged? A. Medial cord. B. Posterior cord. C. Lower trunk. D. Roots. E. Upper trunk. 3. The answer is D. Winged scapula is caused by paralysis of the serratus anterior muscle that results from damage to the long thoracic nerve, which rises from the roots of the brachial plexus, C5-C7. 4. A 16-year-old patient has weakness flexing the metacarpophalangeal joint of the ring finger and is unable to adduct the same finger. Which of the following muscles is most likely paralyzed? A. Flexor digitorum profundus. B. Extensor digitorum. C. Lumbrical. D. Dorsal interosseous. E. Palmar interosseous. 4. The answer is E. The dorsal and palmar interosseous and lumbrical muscles can flex the metacarpophalangeal joints and extend the interphalangeal joints. The palmar interosseous muscles adduct the fingers, while the dorsal interosseous muscles abduct the fingers. The flexor digitorum profundus flexes the distal interphalangeal, dip, joints. 5. A 27-year-old patient presents with an inability to draw the scapula forward and downward because of paralysis of the pectoralis minor. Which of the following would most likely be a cause of his condition? A. Fracture of the clavicle. B. Injury to the posterior cord of the brachial plexus. C. Fracture of the coracoid process. D. Axillary nerve injury. E. Defects in the posterior wall of the axilla. 5. The answer is C. The pectoralis minor inserts on the coracoid process, originates from there, second to the 5th ribs, and is innervated by the medial and lateral pectoral nerves that arise from the medial and lateral cords of the brachial plexus. It depresses the shoulder and forms there. Anterior wall of the axilla. The pectoralis minor has no attachment on the clavicle. 6. A 22-year-old patient received a stab wound in the chest that injured the intercostal brachial nerve. Which of the following conditions results from the described lesion of the nerve? A. Inability to move the ribs. B. Loss of tactile sensation on the lateral aspect of the arm. C. Absence of sweating on the posterior aspect of the arm. D. Loss of sensory fibers from the second intercostal nerve. E. Damage to the sympathetic preganglionic fibers. 6. The answer is D. The intercostrobrachial nerve arises from the lateral cutaneous branch of the second intercostal nerve and pierces the intercostal and serratus anterior muscles. It may communicate with the medial brachial-cutaneous nerve, and it supplies skin on the medial side of the arm. It contains no skeletal motor fibers but does contain sympathetic postganglionic fibers, which supply sweat glands. 7. A 16-year-old boy fell from a motorcycle, and his radial nerve was severely damaged because of a fracture of the midshaft of the humerus. Which of the following conditions would most likely result from this accident? A. Loss of wrist extension leading to wrist drop. B. Weakness in pronating the forearm. C. Sensory loss over the ventral aspect of the base of the thumb. D. Inability to oppose the thumb. E. Inability to abduct the fingers. 7. The answer is A. Injury to the radial nerve results in loss of wrist extension, leading to wrist drop. The median nerve innervates the pronator teres, pronator quadratus, and opponens pollicis muscles and the skin over the ventral aspect of the thumb. The ulnar nerve innervates their dorsal interosseous muscles, which act to abduct the fingers. 8. A patient comes in complaining that she cannot flex her proximal interphalangeal joints. Which of the following muscles appears to be paralyzed on further examination of her finger? A. Palmar interossi. B. Dorsal interossi. C. Flexor digitorum profundus. D. Flexor digitorum superficialis. E. Lumbricals. 8. The answer is D. The flexor digitorum superficialis muscle flexes the proximal interphalangeal joints. The flexor digitorum profundus muscle flexes the dip joints. The palmar and dorsal interossi and lumbricals can flex metacarpophalangeal joints and extend the interphalangeal joints. The palmar interossi adduct the fingers, and the dorsal interossi abduct the fingers. 9. A 21-year-old woman walks in with a shoulder and arm injury after falling during horseback riding. Examination indicates that she cannot adduct her arm because of paralysis of which of the following muscles? A. Teres minor. B. Supraspinatus. C. Latissimus dorsi. D. Infraspinatus. E. Serratus anterior. 9. The answer is C. The latissimus dorsi adducts the arm, and the supraspinatus muscle abducts the arm. The infraspinatus and the teres minor rotate the arm laterally. The serratus anterior rotates the glenoid cavity of the scapula upward, abducts the arm, and elevates it above a horizontal position. 10. A 35-year-old man walks in with a stab wound to the most medial side of the proximal portion of the cubital fossa. Which of the following structures would most likely be damaged? A. Biceps brachii tendon. B. Radial nerve. C. Brachial artery. D. Radial recurrent artery. E. Median nerve. 10. The answer is E. The contents of the cubital fossa from medial to lateral side are the median nerve, the brachial artery, the biceps brachii tendon, and the radial nerve. Thus, the median nerve is damaged. The radial recurrent artery ascends medial to the radial nerve. 11. The police bring in a murder suspect who has been in a gunfight with a police officer. There. Suspect was struck by a bullet in the arm. His median nerve has been damaged. Which of the following symptoms is likely produced by this nerve damage? A. Waiter's tip hand. B. Claw hand. C. Wrist drop. D. Ape hand. E. Flattening of the hypothon eminence. 11. The answer is D. Injury to the median nerve produces the ape hand, a hand with the thumb permanently extended. Injury to the radial nerve results in loss of wrist extension, leading to wrist drop. Damage to the upper trunk of the brachial plexus produces waiter's tip hand, a claw hand, and flattening of the hypothon eminence or atrophy of the hypothenar muscles result from damage to the ulnar nerve. 12. An automobile body shop worker has his middle finger crushed while working on a transmission. Which of the following muscles is most likely to retain function? A. Extensor digitorum. B. Flexor digitorum profundus. C. Palmar interosseous. D. Dorsal interosseous. E. Lumbrical. 12. The answer is C. The extensor digitorum, flexor digitorum profundus, dorsal interosseous, and lumbrical muscles are attached to the middle digit, but no palmar interosseous muscle is attached to the middle digit. 13. A 14-year-old boy falls on his outstretched hand and has a fracture of the scaphoid bone. The fracture is most likely accompanied by a rupture of which of the following arteries? A. Brachial artery. B. Ulnar artery. C. Deep palmar arterial arch. D. Radial artery. E. Princeps pollicis artery. 13. The answer is D. The scaphoid bone forms the floor of the anatomic snuff box, through which the radial artery passes to enter the palm. The radial artery divides into the princeps pollicis artery and the deep palmar arch. 14. A 12-year-old boy walks in, he fell out of a tree and fractured the upper portion of his humerus. Which of the following nerves are intimately related to the humerus and are most likely to be injured by such a fracture? A. Axillary and musculocutaneous. B. Radial and ulnar. C. Radial and axillary. D. Median and musculocutaneous. E. Median and ulnar. 14. The answer is C. The axillary nerve passes posteriorly around the surgical neck of the humerus, and the radial nerve lies in the radial groove of the middle of the shaft of the humerus. The ulnar nerve passes behind the medial epicondyle, and the median nerve is vulnerable to injury by supracondylar fracture of the humerus, but these nerves lie close to or in contact with the lower portion of the humerus. The musculocutaneous nerve is not in direct contact with the humerus. 15. A man injures his wrist on broken glass. Which of the following structures entering there palm superficial to the flexor retinaculum may be damaged? A. Ulnar nerve and median nerve. B. Median nerve and flexor digitorum profundus. C. Median nerve and flexor pollicis longus. D. Ulnar artery and ulnar nerve. E. Ulnar nerve and flexor digitorum superficialis. 15. The answer is D. Structures entering the palm superficial to the flexor retinaculum include their ulnar nerve, ulnar artery, palmaris longus tendon, and palmocutaneous branch of the median nerve. The median nerve, the flexor pollicis longus, and the flexor digitorum superficialis and profundus run deep to the flexor retinaculum. 16. A patient with Bennett fracture, a fracture of the base of the first metacarpal bone, experiences an impaired thumb movement. Which of the following intrinsic muscles of the thumb is most likely injured? A. Abductor pollicis brevis. B. Flexor pollicis brevis, superficial head. C. Opponens pollicis. D. Adductor pollicis. E. Flexor pollicis brevis, deep head. 16. The answer is C. The opponens pollicis inserts on the first metacarpal. All other intrinsic muscles of the thumb, including the abductor pollicis brevis, the flexor pollicis brevis, and their adductor pollicis muscles, insert on the proximal phalanges. 17. A 27-year-old pianist with a known carpal tunnel syndrome experiences difficulty in finger movements. Which of the following intrinsic muscles of her hand is paralyzed? A. Palmar interossi and adductor pollicis. B. Dorsal interossi and lateral 2 lumbricals. C. Lateral 2 lumbricals and opponens pollicis. D. Abductor pollicis brevis and palmar interossi. E. Medial 2 and lateral 2 lumbricals. 17. The answer is C. The median nerve innervates the abductor pollicis brevis, opponens pollicis, and 2 lateral lumbricals. The ulnar nerve innervates all interossi, palmar and dorsal, their adductor pollicis, and the 2 medial lumbricals. 18. A 31-year-old roofer walks in with tenosynovitis resulting from a deep penetrated wound in the palm by a big nail. Examination indicates that he has an infection in the ulnar bursa. This infection most likely resulted in necrosis of which of the following tendons? A. Tendon of the flexor carpi ulnaris. B. Tendon of the flexor pollicis longus. C. Tendon of the flexor digitorum profundus. D. Tendon of the flexor carpi radialis. E. Tendon of the palmaris longus. 18. The answer is C. The ulnar bursa, or common synovial flexor sheath, contains the tendons of both the flexor digitorum superficialis and profundus muscles. The radial bursa envelops their tendon of the flexor pollicis longus. The tendons of the flexor carpi ulnaris and the palmaris longus are not contained in the ulnar bursa. 19. An 18-year-old boy involved in an automobile accident presents with an arm that cannot abduct. His paralysis is caused by damage to which of the following nerves? A. Suprascapular and axillary. B. Thoracodorsal and upper subscapular. C. Axillary and musculocutaneous. D. Radial and lower subscapular. E. Suprascapular and dorsal scapular. 19. The answer is A. The abductors of the arm are the deltoid and supraspinatus muscles, which are innervated by the axillary and suprascapular nerves, respectively. The thoracodorsal nerve supplies the latissimus dorsi, which can adduct, extend, and rotate the arm medially. The upper and lower subscapular nerves supply the subscapularis, and the lower subscapular nerve also supplies the teres major. Both of these structures can adduct and rotate the arm medially. Their musculocutaneous nerve supplies the flexors of the arm, and the radial nerve supplies their extensors of the arm. The dorsal scapular nerve supplies the levator scapulae and rhomboid muscles, these muscles elevate and adduct the scapula, respectively. 20. A 17-year-old boy with a stab wound received multiple injuries on the upper part of their arm and required surgery. If the brachial artery were ligated at its origin, which of the following arteries would supply blood to the profunda brachii artery? A. Lateral thoracic. B. Subscapular. C. Posterior humeral circumflex. D. Superior ulnar collateral. E. Radial recurrent. 20. The answer is C. The posterior humeral circumflex artery anastomoses with an ascending branch of the profunda brachii artery, whereas the lateral thoracic and subscapular arteries do not. The superior ulnar collateral and radial recurrent arteries arise inferior to the origin of their profunda brachii artery. 21. A 23-year-old woman who receives a deep cut to her ring finger by a kitchen knife is unable to move the metacarpophalangeal joint. Which of the following pairs of nerves was damaged? A. Median and ulnar. B. Radial and median. C. Musculocutaneous and ulnar. D. Ulnar and radial. E. Radial and axillary. 21. The answer is D. The metacarpophalangeal joint of the ring finger is flexed by the lumbrical, palmar, and dorsal interosseous muscles, which are innervated by the ulnar nerve. The extensor digitorum, which is innervated by the radial nerve, extends this joint. The musculocutaneous and axillary nerves do not supply muscles of the hand. The median nerve supplies the lateral two lumbricals, which can flex metacarpophalangeal joints of the index and middle fingers. 22. A 27-year-old baseball player is hit on his forearm by a high-speed ball during the World Series, and the muscles that form the floor of the cubital fossa appear to be torn. Which of the following groups of muscles have lost their functions? A. Brachioradialis and supinator. B. Brachialis and supinator. C. Pronator teres and supinator. D. Supinator and pronator quadratus. E. Brachialis and pronator teres. 22. The answer is B. The brachialis and supinator muscles form the floor of the cubital fossa. Their brachioradialis and pronator teres muscles form the lateral and medial boundaries, respectively. The pronator quadratus is attached to the distal ends of the radius and the ulna. 23. A 23-year-old man complains of numbness on the medial side of the arm following a stab wound in the axilla. On examination, he is diagnosed with an injury of his medial brachial cutaneous nerve. In which of the following structures are the cell bodies of the damaged nerve involved in numbness located? A. Sympathetic chain ganglion. B. Dorsal root ganglion. C. Anterior horn of the spinal cord. D. Lateral horn of the spinal cord. E. Posterior horn of the spinal cord. 23. The answer is B. The medial brachial cutaneous nerve contains sensory, general somatic, afferent, GSA, fibers that have cell bodies in the dorsal root ganglia, and an injury of these GSA fibers causes numbness of the medial side of the arm. It also contains sympathetic postganglionic fibers that have cell bodies in the sympathetic chain ganglia. The anterior horn of the spinal cord contains cell bodies of skeletal motor, general somatic afferent, GSE, fibers. And the lateral horn contains cell bodies of sympathetic preganglionic fibers. The posterior horn contains cell bodies of interneurons. 24. A 38-year-old home builder was involved in an accident and is unable to supinate his forearm. Which of the following nerves are most likely damaged? A. Suprascapular and axillary. B. Musculocutaneous and median. C. Axillary and radial. D. Radial and musculocutaneous. E. Median and ulnar. 24. The answer is D. The supinator and biceps brachii muscles, which are innervated by the radial and musculocutaneous nerves, respectively, produce supination of the forearm. This is a question of two muscles that can supinate the forearm. 25. A 31-year-old patient complains of sensory loss over the anterior and posterior surfaces of the medial third of the hand and the medial 1 1/2 fingers. He is diagnosed by a physician as having funny bone symptoms. Which of the following nerves is injured? A. Axillary. B. Radial. C. Median. D. Ulnar. E. Musculocutaneous. 25. The answer is D. The ulnar nerve supplies sensory fibers to the skin over the palmar and dorsal surfaces of the medial third of the hand and the medial 1 1/2 fingers. The median nerve innervates the skin of the lateral side of the palm, the palmar side of the lateral 3 1/2 fingers, and the dorsal side of the index finger, the middle finger, and 1/2 of their ring finger. The radial nerve innervates the skin of the radial side of the hand and the radial 2 1/2 digits over the proximal phalanx. 26. A patient with a deep stab wound in their middle of the forearm has impaired movement of the thumb. Examination indicates a lesion of the anterior interosseous nerve. Which of the following muscles is paralyzed? A. Flexor pollicis longus and brevis. B. Flexor pollicis longus and opponens pollicis. C. Flexor digitorum profundus and pronator quadratus. D. Flexor digitorum profundus and superficialis. E. Flexor pollicis brevis and pronator quadratus. 26. The answer is C. The anterior interosseous nerve is a branch of the median nerve and supplies the flexor pollicis longus, half of the flexor digitorum profundus, and the pronator quadratus. The median nerve supplies the pronator teres, flexor digitorum superficialis, palmaris longus, and flexor carpi radialis muscles. A muscular branch, the recurrent branch, of the median nerve innervates the thenar muscles. 27. A 29-year-old patient comes in, he cannot flex the distal interphalangeal, dip, joint of their index finger. His physician determines that he has nerve damage from a supracondylar fracture. Which of the following conditions is also a symptom of this nerve damage? A. Inability to flex the dip joint of the ring finger. B. Atrophy of the hypothenar eminence. C. Loss of sensation over the distal part of their second digit. D. Paralysis of all the thumb muscles. E. Loss of supination. 27. The answer is C. The flexor digitorum profundus muscle flexes the dip joints of the index and middle fingers and is innervated by the median nerve, which also supplies sensation over their distal part of the second digit. The same muscle flexes the dip joints of the ring and little fingers, but receives innervation from the ulnar nerve, which also innervates the hypothenar muscles. The median nerve innervates the thenar muscles. The radial nerve innervates the supinator, abductor pollicis longus, and extensor pollicis longus and brevis muscles. The ulnar nerve innervates the adductor pollicis. The musculocutaneous nerve supplies the biceps brachii that can supinate the arm. 28. A 27-year-old man with cubital tunnel syndrome complains of numbness and tingling in the ring and little finger and back and sides of his hand because of damage to a nerve in their tunnel at the elbow. Which of the following muscles is most likely to be paralyzed? A. Flexor digitorum superficialis. B. Opponens pollicis. C. 2 medial lumbricals. D. Pronator teres. E. Supinator. 28. The answer is C.